I'm Dr. Meredith Godwin with Wayne Health Psychiatric Associates at Wayne Memorial Hospital. Many women experience postpartum depression. Some women may have a predisposition for postpartum depression because maybe they've suffered from depression or anxiety in the past, or maybe they have other underlying mental health issues like bipolar disorder. The baby blues is something where women will sometimes feel a little bit more moody, a little bit more tearful in the week or two after the birth of their child, and that is very normal. Baby blues doesn't necessarily mean that a woman will develop postpartum depression. That being said, there are a lot of symptoms that are more serious and that would make me think about postpartum depression even early on. Certainly if a woman has thoughts of suicide, thoughts of wanting to die, thoughts of wanting to hurt herself or worried that she may hurt her child, that would be a red flag, and I would certainly want a woman like that to get immediate treatment because that still is very treatable, and that does not mean that she's going to die or hurt her child. It means that she needs some professional help. Also, if a woman continues to have problems with sleep, if a woman is not able to eat and has problems with her appetite, if her ability to take care of herself or her baby are limited, then that certainly suggests postpartum depression. But certainly it is not a woman's fault. No one would choose for this to happen. It's not a matter of not having enough strength or mental fortitude. It's not a matter of not having enough spiritual faith. It's a medical illness that needs treatment, and the good news is it's very treatable. It's very treatable with medicine. It's very treatable with talk therapy. Somewhere between 1 in 5 women and 1 in 8 women will at some point experience postpartum depression, so it's certainly not uncommon. And I think a lot more people have symptoms than will report them to their friends or to their family because of this stigma with mental illness that's still here. OB/GYN doctors actually do a really great job of screening women for postpartum depression symptoms, and often will treat women with medicine or with different things within their office. Sometimes, though, depending on a woman's preference or her needs, it may be appropriate for her to see a psychiatrist. And it's kind of exciting to take care of women with postpartum depression because they come to me feeling really bad, really hopeless, really tearful, really anxious, and they look miserable. And within, a month or two, I'll see them and they're happy, they're smiling, they're, taking their kids to the park, they're going out to dinner with their husband. They are back to normal. If there's an emergency, particularly if a woman is having thoughts of harming herself or the baby, or really just not able to care for herself at all, or if she is psychotic, meaning maybe hearing voices or whispers or seeing things, which is very rare, but if that would happen, I would say that that's an emergency. In any area, you can certainly call 911 and go to an emergency room. Here at Wayne Memorial Hospital, you could certainly call the number, which would be 919-731-6255, which is the inpatient psychiatric unit. It doesn't necessarily mean that you would be admitted, but there's a 24-hour service so that if it was appropriate for you to be admitted to the hospital, we could arrange that, or at least have some advice from the psychiatrist who's on call about where to go from here. Is this an appropriate thing to go to the emergency room? Is this an appropriate thing to follow up and make an appointment in a clinic later? The big thing is to talk to some sort of medical professional, whether it be your primary care doctor or even your pediatrician, even your baby's pediatrician, and that's completely fine. Let them know that you're having some problems, and then they will make sure that you get the help that you need.